news this morning. With the fresh start of a new year, some couples may be thinking about family planning. And with that, well, you may find yourself at a roadblock dealing with infertility. But guess what? You are not alone. And we've got to look at some options to actually consider. Joining us is Dr. Julian Escobar, a fertility physician from Conceive Fertility Center. Dr. Escobar, thank you so much for waking up early and being here.
Cleo, thank you so much for having me.
No, seriously.
What a treat.
Yes. So this topic is near and dear to my heart because I think in 2021, my husband and I were like, all right, we're ready. Let's start family planning. And nothing was happening. So I was like, wait, let me see what's wrong, what's going on, right? Thank God. But when should someone get that fertility evaluation? Because that's what I needed.
So for sure, any couple who's tried to conceive for over a year should get some help and at least an evaluation. If you're over 35, 6 months, if you have any medical conditions like you don't have regular cycles or you've had extensive pelvic surgery, you should go earlier. And if you're trying to delay pregnancy and you're in your 30s, you should at least get an evaluation so you can make a conscious decision.
You know, you mentioned age, being 35 or older. Why is age, I guess, such a huge concern here?
It's a huge concern because even if you have no physical factors that impede fertility, if you're 35, your chances of conception are about half that when you were 30. And if you're 40, they're about a fourth or a fifth. So in a DFW, with all the professional women we have who've gone to school, folks in their careers, got married in their 30s, it's the main factor for most people is going to be age. And that affects pregnancy rates, it's going to increase their miscarriage rates and their chance of aneuploidy, such as Down syndrome, which is a huge deal.
Right, right. I guess what is the most common fertility issue, if I can say, that you encounter?
I would say that ovulatory dysfunction obviously is a big issue and tubal factor, but the main thing I think we see in the DFW is going to be these professional women who are trying to get pregnant in their 30s, early 40s, maybe second marriage, or it never happened and they're trying to find options to become moms. And so that is the type of patient that we see the most. So it's not necessarily someone who knows they have a fertility problem, but more like someone who, because of age, now they have to be more proactive to build a family they want.
What would you do, I guess, when it comes to concrete medical problems to seek that fertility care?
So, if you go to your OBGYN first, if you have that, but you can also go straight to a fertility physician. I think the bigger you consider your situation, the more you should just go straight to a fertility physician. But if you have a good relationship with your OBGYN and they're treating you seriously, like I said, a year maximum or 6 months if you're over 35, then start there.
You know, let's be honest here. I guess when you start trying and nothing's really happening, it can be, I guess, a daunting feeling to be like, wait, do I really need to go and get help? And I feel like you guys at Conceive Fertility Center make this process easy and very comfortable. How important is that?
I think it's super important because you want to empower yourself. Like someone like you who's a professional woman, you have higher expectations than a 22-year-old. So when you're a good time in your career or you're a teacher and you want to deliver in the summer, or you want to have several children and you're 38 and just starting, or you have a child of a certain gender, you want to optimize your options, and you're already a very pragmatic person and you organize and you're probably type A, and so a lot of these people can get at least organized. Just because you come see us doesn't mean that you're going to do fertility treatment. Most people have multiple options, but at least you have a plan of attack.
That's exactly what I'm talking about. Now, Dr. Escobar, I got to tell you, I follow you on social media and you're so vocal and you make women feel so comfortable, couples as well. How can people contact you? How can people get in contact with you?
So I'm on Instagram and Facebook and TikTok, and patients have made me go into there. That's how people like to communicate. And so it's just Dr. Julian Escobar. And so just come follow any questions I can answer for people. But I just want to demystify the process. It's so common. 1 in 6 couples go through this. Like I said, there's the other people who don't even have fertility issues, but they want to build a family they want. This is the center of our lives. And so I just try to give patients all the information they want, so in the comfort of their homes, they know how to empower themselves and perhaps take that further to their OBGYN or a fertility doctor.
And you do. Dr. Escobar, thank you so much. And thank you for joining us this morning, Dr.
Thank you so
Julian
much.
Escobar,
Most beautiful pregnant woman.
Thank you, Doc. I'm trying. I'm really trying. Thank you so much.